I'm Allyssa Skelton, and I'm going to do my head-to-toe video assessment. Allyssa, I'm going to be your nurse today. Can you state your name and date of birth?
Sure, it's Kristen Goodwin, 8/9/1987.
Perfect. Why are you here today?
I'm here for a physical for a new job.
Okay, and what time was your appointment?
3:30.
Okay, perfect. Do you have any allergies to medications?
No.
Any pertinent family history that we have?
No.
No? Okay. So then I would take the patient's vital signs, which are blood pressure, temperature, pulse, respirations, O2, and I would ask her about any pain. Have any pain today?
No, I do not.
Okay, so patient is alert, oriented to time, place, situation. She's dressed appropriately for the weather, and her speech is not slurred. Okay, so I'm gonna go and get your height and weight. If you can just stand up for me really quick.
Sure.
So I'm gonna do the Romberg's test. The patient doesn't seem to sway back and forth. So if she's balanced, if you can go ahead and lean over and touch your toes. I'm just gonna check her spine for any abnormal curvatures, which she seems to have none. Her shoulders are even along with her hips. Okay, go ahead and stand back up and we'll walk to the scale. Can you walk heel to toe, please?
Yes.
And now on your tippy toes and on your heels. Good. So patient's gait is balanced. She has no difficulty walking. So with her height, weight, and waist circumference, I can test her BMI, which is 21, and that's within normal limits. Okay, go ahead and step back towards the bed.
And I'm going to have you step on the scale. I'm going to check her weight. I'm doing 22.
Okay. So the patient's skin is clear, no sign of blemishes or anything. She's not abnormally pale or jaundice. The patient's hair is evenly distributed. It looks clean and kept. There seems to be no sign of infestations or anything, but I'll check just to be sure. If I palpate her here, there's no abnormal bumps, no bruising or anything. And while I'm here, I could also check her sinuses with the occipital and her pre and postmandibular, along with her submaxillary and then her subclavicular, which I should feel none of them. So the patient's ears are symmetrical on both sides to the top of the patient's eyes. There seems to be no drainage out of them. The exterior is pink. If I had an otoscope, I would pull the pin up and back, and inside the tympanic membrane would be a gray and pearly color. The patient's nose is symmetrical. I palpate. Do you have any pressure or pain? No?
No.
I could also palpate her sinuses. No pain?
No.
drainage coming out of her nose. Inside is pink and moist. Okay, I'm just gonna test for patency. If you can plug one of your nostrils and breathe out. Good, and on the other side. Good, perfect. Okay, so the patient's eyes, her iris is a blue color, the pupils look equal. The sclera is a white. You can just look up for me. The conjunctiva is a pink color and moist, which is good. Okay, so now I'm just gonna test for your reactivity to light. If you can look right at my nose. So when I shine the light, the pupil constricts, and then again, the opposite eye also constricts at the same time. One more time. Good. Okay. So the pupils are round, equal round, and reacted to light. Accommodation, if you can just follow the pen light for me. As I bring it back, the pupils dilate, and as I bring it forward, they constrict again. Then they converge in the middle. Okay. The 6 cardinal movements of gaze to test for extraocular eye movements. If you can just follow the pen light without moving your head. Okay, good. I can also test for cranial nerves. If you can smile for me, frown, wrinkle your forehead, puff out your cheeks, stick your tongue out, move it back and forth. Okay, good. I can also check for the patient's lips. Sorry. Her lips are a pink color. They're moist, not cracked. They're symmetrical to both sides of her face. You can open your mouth. Do you have any dentures? No. Okay, so her teeth are white and pearly. The inside of her mouth is pink and moist. There's no signs of lesions. The hard and soft palate are intact. The tongue, pink color. No sign of lesions either. Good. Okay, can you stick your tongue out for me? And say ah. Perfect. So the patient's uvula goes up and back when she talks. So before I do a respiratory, I'm going to have you do range of motion, okay? If you can stick your arms out and move them in circles, and the other way, and your wrists. Perfect. Bring your arms in and up. You can push against me. Perfect. And pull. Good. Test your hand strength. Good. So patient's upper extremities are equal and strong bilaterally. Can you kick out your leg for me one at a time? Good. Go ahead and push against me, and again. One more time, and pull. One more time. Good. Okay. Can you rotate your ankles for me? Yes. Okay. And then if you can push against my hands and push the gas pedal. Perfect. Good. Okay, so now I'm going to do a respiratory evaluation for you. So the patient doesn't seem to have any labor in her breathing. Yeah. I'm going to palpate. Any pain?
No.
Sorry. No pain. Okay, percuss. And then I would auscultate in 6 different spaces. Can you take a deep breath for me? Again. Beautiful. So patient's lungs are clear. No sign of crackles, wheezes, or anything like that. Now I can go to the back. Okay, so while I'm here, I can test for thoracic expansion before anything, which is about T9, T10. If you can take a deep breath for me. Good. So my hands expand together bilaterally. I can also test for tactile fremitus. You can say 99.
99.
And again.
99.
And again.
99.
Good. So the further I go down her back, the less vibration I feel on her back with my hands. Okay, so again, I'm going to palpate, find out where her scapula is. Okay, no pain.
No.
Okay, and percuss. Excuse me. Okay, good. I'm going to auscultate one more time, but in 10 spots. Take a deep breath. Okay, good. Okay, again, lung sounds are clear, no sign of crackles, wheezes, or anything like that. Okay, if you can lay down on the bed, I'm going to do a cardiac evaluation for you. So the patient should sit between 30 and 45 degrees. Are you comfortable?
Yes.
Sorry.
Yes, thank you.
Okay, so I'd assess the patient's precardium. There's no sign of a pacemaker or anything. All you see is just plain skin. So I would listen to her heart, palpate first. We find her clavicle. The second intercostal space is the aorta. And the second intercostal left sternal is the pulmonic. Third is Erb's point. Fourth is the tricuspid. And then fifth, midclavicular, would be her mitral valve, which is also the maximal point of impulse. Now I would auscultate. Okay, and then I'd go back with the bell. Okay, good. So there's no extra heartbeats, no sign of bruits, so the patient is good. Now I'm going to check your pulse points, starting with your temporal. Good. Your carotid, one at a time, so I don't cut off oxygen to the brain. Okay, if you can look up and to your left, patient has no jugular vein distension. I can also listen to the carotid for bruits with the bell. And I hear nothing, so no sign of bruits. I can also see the trachea right here, that it's also midline to face, I should not be able to feel the thyroid. Can you just swallow for me really quick? Good, and there's no tracheal tugging. Okay, so along with the temporal and carotid, I can check her brachial pulses. Good. Radial. We would also do a femoral. If you can lift your knees, perfect. Popliteal. Posterior tibialis. And then dorsalis pedis. Good. So all her pulse points are equal and strong bilaterally. While I'm down here, I can also check for capillary refills in her toes, which is good. The blood refills within 3 seconds. She has no signs of edema on her legs. No scratches or anything either. I'm also going to test for Babinski's. Ready? So patient is ticklish but has a negative Babinski's. While I'm here, I can test her capillary refill in her fingers, which are good. Both sides also refill with blood within 3 seconds, which is normal. Now I'm gonna do an abdominal. Raise this a little more, maybe. There we go. So I can also see that the patient has no clubbing on her fingers. There's a full 180-degree. Okay, I'm gonna lift up your shirt, okay? Okay, so patient's abdomen seems to have no distension, there's no bruising. Okay, I'm gonna auscultate starting in the right lower quadrant. I should hear 5 to 35 gurgles in a minute. Okay, good. Now I can percuss. I should hear a more timpani sound. Good. I'm gonna palpate. Are you feeling nauseous or anything?
No.
Okay. Start with light palpation. Okay, and then a deep palpation. There seems to be no sign of any masses or anything in her abdomen. I'd also check for the abdominal aorta, which I cannot see. I would also check for bruise with the bell, which I hear nothing, so that's good. Okay. So we're all set. Do you have any questions for me?
No.
No? Bed in the lowest position. Make sure the patient has a call. Perfect. Okay, thank you.
Thank you.